And here is your question.
Okay. Okay, I'm ready.
All right. So if you have read and understood, considering it communication skills station, please begin.
Hello.
Hello.
I'm Dr. Ali Bade. Can I confirm that you are mother of the child?
Yes,
Can I confirm your name, please?
my name is X.
Hello, Mrs. X. I'm really so sorry. I know this is a very difficult feeling for you because we couldn't contact you before taking the child to theaters. I'm here to help you and to answer all your questions and to update you about your child conditions. Okay, Mrs. X. Hello.
Yes, yes.
Okay, Mrs. X. Can you tell me what do you know so far about your child condition?
Look, doctor, I was on my duty and just received the call that your baby has fallen down and we have shifted
Yes.
him to the hospital. But I just know about this, nothing else.
Yes, really, I'm so sorry. I see your worries, Mrs. X. I told by his father he falling down while playing in the school, and he is probably harmed himself. I apologize to you in behalf of the all surgical staff here. You couldn't see him before taken to theaters, and we couldn't wait you until to arrive and to see him. I see your difficult feeling, but the surgery is the only one option to save him life.
Okay, but doctor, can you tell me how has he got the injury? Do you know?
Yes, okay, Mrs. X. We do some investigation in the ER, but unfortunately, the scan of the abdomen show that there is a spleen rupture. I will explain it to you, Mrs. X. The spleen ruptures. I will explain it to you in my papers. Please look at me. And if this tummy of your sons, here in the upper left part, there is organ called spleen. And the problem with this organ, he received a lot of blood from the body. So when this organ is injured, the main problem there is a bleedings. So he now in the operations to control this bleeding and to save him life. Are you
Doctor,
follow me, Mrs. X?
yes, I am listening to you. Can you
Yes,
tell me,
yes.
is it a serious condition?
Mrs. X, a rupture spleen is a serious conditions, okay? And I will assure you, he is now with experienced surgeons and experienced hands. And all of us here, we take care of your sons in the theaters. And after the operation, all of us, we take care of him. Right, Mrs. X?
Yes, I can understand. But can
Yes.
you told me when he was brought here, his father was with him or not?
Again, ask me again, please.
Yes, his father accompany my baby, my child to the hospital or not?
Really, I'm not sure, but your husband, he accepted the operations, and
So yes, yes, I can see that he has signed the consent form. But what
yes,
he
yes,
told you at
yes.
that time?
Just he bring the baby, and I in the first look of the baby, there is abrasion in his abdomen, and this trauma, as I set you to the left side of his abdomen and injury his spleens. So that happens. He falling down in the school.
Okay. So after finishing this surgery, will he need some medications, and how long he will stay in the hospital?
Okay, right, Mrs. X. After the operations, he will be in the recovery rooms for a few hours, and at these times you couldn't see him. But I will assure you, once he became stable, I will let you see your child. Okay, right? And after the recovery, he will stay in the hospitals to make sure for your health. And the medication, we will give him vaccines to prevent some infections.
Okay. And can you tell me how long this operation will go? How many time it will take, when it will be finished?
The operations, or what?
Yes, yes. How long, how much time this operation will last?
Really, the operation is depend to the condition of the child and the type of the injury of the spleens. So whenever the child out of the I will let you know. I will assure you, right?
Okay. And can you tell me when he will be able so that I can take him to home?
The after operation, I said you, he will be in the recovery room for the few hours, and after he regained his conscious and became stable, he will be admitted to hospitals till we make sure of his health. Okay, and after that, we can discharge him at home.
Okay.
Okay, right. Do you have any other question, Mrs. X?
No, I don't have any other concerns.
Okay, thank you very much, Mrs. X. I will let my phone number with the nurse. Call me. Don't hesitate to call me. I will be around you to help you and to answer your questions. And if you need anyone from your family to help you, I will call him immediately, right?
Okay. Okay.
Thank you very much, Mrs. X. Thank you very much.
You still have 1 minute in which you can maybe discuss the complications of post-splenectomy and vaccinations and.
Okay, and after operation,
and social services. Yes.
Okay, after operation, there may be a complications. Maybe they are bleeding, and maybe also there is infection of the wound.
Yes.
That it.
For which, yes, antibiotics and vaccinations.
Yes,
which one?
yes, ma'am. That's why I asked him.
He told, okay, but the social services.
Okay.
What about the social services?
Yes, you have to tell, because in this scenario, father, he has the habit of drinking, and this is unclear that child fell or he did something to the child. So you would have to report the matter to the social services for the best of the child. And a mother would not want it to be highlighted, but still you would say, for time went now. For the sake of child's protection and for the sake of child's safety, you would have to involve the social services in it. And they'll take care of the home situation of child. Okay, we can discuss now. Thank you. Right.